Naturowhat? It's a question I often get. Either people know exactly who I am and get really excited and ask me all sorts of questions about what I do, or they give me a blank stare and look as if I made up a word and a profession. I am a naturopathic doctor, and what that is a fully licensed practitioner, and we get the same education as a medical doctor, an MD, or a doctor of osteopathic medicine, a DO. Basically, we focus on health and prevention. We focus on the whole body, the individual, the underlying root cause to diseases, not just the symptoms, never the symptoms. We also understand that there is great power in the natural order of things. There is great power in nature, in nutrition, in air we breathe, in sunlight. And we understand that. We understand that the body has a beautiful ability to heal itself, and that's the way we facilitate healing. So how do we treat people? How do we prevent diseases? We do this with something that's called modalities, and we have many, many, many modalities. We have acupuncture, we have physical manipulation, we have botanicals, nutrition, even counseling. The list goes on and on of what our scope is. We use drugs and surgery as a last resort, and sometimes, those things are necessary. So the difference between a naturopathic doctor and a medical doctor really is in the approach to the patient, in the philosophy we use to treat patients. And I'm going to give you an example of this. So Ty is a 3-year-old boy. He's highly active, had a normal development in his childhood up until this point. He eats a diet of macaroni and cheese and McDonald's. He has developed eczema on his extremities for the past few months. He was taken to a local medical doctor, and the doctor wrote him a prescription for steroids very quickly, didn't really look at his eczema. The steroids worked, but after about 10 days, the eczema returned with a vengeance and had spread to his entire body and face, and now he had developed respiratory asthma as well. He was again taken back to the medical doctor and was given steroids, again, an inhaler, and more topical treatments. So when Ty turned 4, his eczema had resolved a little bit, but he then developed a fever of 104 and started to have seizures. He started to have convulsions. He was rushed to the emergency room where they ran many, many tests on him, and it was discovered that his thyroid hormone was 5 times the normal value. He had developed hyperthyroidism, and this is a condition virtually never seen in children. So what did conventional medicine do? The only tools they had in their toolbox is surgery and drugs. And that's what they did. They removed his thyroid and then gave him a pill to supplement his thyroid function. So Ty, at 4 years old, is now completely dependent on a drug for the rest of his entire life. And this is unfortunate because his root cause was not addressed, and the body reacted, and now he has this disease, unfortunately. On the other side of the spectrum, Ty has a little brother. His name's Mason. He's 2 years younger, and when Mason turned 3 years old, he started to develop the same symptoms as Ty. He developed eczema. So Mason has the same factors that Ty did. He has the same genetics, the environment, and the diet. But instead of being taken to a medical doctor, he was taken to a naturopath. This naturopath evaluated him extensively for an hour with his mother, talking about his development, his lifestyle, what he ate, and it was suspected that his eczema was the result of food allergies. And a food allergy panel was run, and it was discovered that Mason was allergic to what we call the big 3 in naturopathic medicine: eggs, dairy, and wheat, and those were major components of his diet. So Mason was taken off these foods. He was given botanicals and some supplements to kind of aid in the healing process in his body. And within 10 days, his eczema completely resolved. And that was unfortunate in his older brother that we didn't prevent this disease, which could have been prevented. So what's the difference between, let me take a step back. What is naturopathic medicine? What are naturopathic doctors? I would say that we are healers that promote health, how to maintain it, and also the prevention of very awful diseases. And even if you have illnesses and diseases already, we have many modalities to get you back to a state of health. We are pioneers in the field, in this healthcare field. I think we all know that our healthcare system is getting worse and people are getting sicker and not better. And we are a small fish in a big pond. There's only 4,000 of us practicing in a sea of 100,000 MDs, medical doctors, and DOs. However, our footprint in healthcare is very large, and it's only getting larger. And there will be a time in the near future, I see, as our growth increases, that naturopathic medicine will not only be what we call alternative medicine, because there's not many of us, will instead be called conventional medicine, and that's because there's just really no messing with nature, and it works.
Thank you, Samantha. Let's all take a moment to fill out our evaluation. And then just before you leave today, make sure to hand your evaluations to the speaker so that they can have that feedback to work off of. Beth, would you mind giving us the timer report for
6 minutes and 47 seconds. Good job.
Sorry, within
Oh man.
6
When you
minutes
held up
and
that yellow
47
card, I was
seconds.
panicking.
Did you see the yellow?
Yeah, it's the legal.
Okay, because I didn't see her looking at me,
Wait.
so I'm like, look
I
here,
saw
look
it.
here.
Okay, and then Beth, when you're ready,
Table
table
okay.
topics time.
It's hard to do all these things and write evaluation. Okay.
Do you want me to time for table topics?
Yes, please.
Will you bring me the cards?
Do we want to film now?
Table topics.
Follow up on people, Beth.
Huh?
Follow up on people.
Okay,
Yeah,
and-
I have to write.
Who's right now?
Isn't it 1 minute?
Okay, I am your table topics master. My goal is to get people thinking on their feet. And what we do is we have you pick out a card from our few envelopes here, and you're just supposed to start talking about whatever comes to mind. You have 2 minutes to complete the task, and let's get started. So any volunteers?
Word of the day.
And don't forget to use the word of the day, because
Molly,
that's
yeah.
how you can win the contest of the best for you.
Woo, good job.
Use the mic if you want.
So as to not waste any more time gagging, the question or table topic is driving at 75 miles per hour. It would take 258 days to drive around one of Saturn's rings. I think I spoke about this in my icebreaker speech, but it was actually learning about the solar system that really got me into science and into medicine in the first place. I don't know why, but it just seems like such a magical place as a child. You hear about space and stars, and that's really, I've always had an interest in astrology and just really our own solar system and what could be out there. I'm not sure what it would take to drive around the Earth. Okay, thank you. I was looking right here.
Nice.
Looking at that.
I didn't quite look that far.
Okay, you had 1 minute. That was awesome. Okay, anybody else? Karthik, come on up.
The topic is book swap. Members bring a book that they sell to the rest, quote unquote sell, to the rest of the club by telling them what they like about the book. Those of you who know me well know that I love my books. At least I've grown to like my books lately. The one that comes to mind this year that has made the biggest difference in my life, once again, is The 4-Hour Workweek by Tim Ferriss. Yes, thank you. It's a fantastic book that I believe all of you should read. It will help you make better use of your time so that you don't lollygag, and will allow you to get the most results in whatever that might be, whether it's grades, whether it's professional development, whether it's doing the things that you always say you want to do but never actually get around to doing. It shows you how to make it all happen and how to make money in the process. It's a fantastic book. I would highly recommend it. And I would certainly, now that I'm no longer lollygagging waiting for the card, just buy the book. Read it over break. It'll take you, the full 3 weeks.
You look easy in someone named. Like you must have known.
I thought a few of these.
Yeah.
Okay, you had 1 minute and 10 seconds. Would anybody else like to try?
I want to go easy.
I'm so proud of all our volunteers. No one knows what it says.
Driving 55 miles per hour instead of 65 miles per hour increases your car mileage by about 15%. So those of you who know me know that sometimes I come to class late. Although I'm not lollygagging, because I am not a lollygagger, I live very far. I have to drive my car at least 75 miles per hour if I leave my house 5 minutes late. I live far southeast of here in Gilbert, and the traffic is pretty hectic in the morning. And although there may be many lollygaggers out on the highway, I'm not one of them. I try to get to school on time. I'd like to be able to increase my mileage by 15%. Maybe if I move closer to the campus, I might be able to do so. But at this point in time, in Q4, as a second-year student, I am pretty stressed with a lot of the work, and although I'm not lollygagging at night, I'm doing my studying, and I tend to get up maybe sometimes 5 to 10 minutes late, and I am driving 65 miles plus in the morning. Thank you.
Nice. All right, 117. Good job. Do we have time for more?
Yeah.
One more?
I'll go. Erin wanted it.
You can switch if you want.
Yeah.
I'll do it. I'm.
Do what?
Oh, you got it. Okay, cool. Perfect.
Okay, if we had the same mortality rate now as in 1900, more than half the people in the world today would not be alive. This makes 0 sense in my brain right now, so I'm just not even going to try and analyze this, but I would like to talk about mortality and how it scares the living bejesus out of me.
All right.
And, don't click me. And I'm lollygagging in my response about mortality rate in 1900. However, we're all gonna die, but the way we're gonna die scares me. And if it's going to be the same as in 1900, I guess saying that more of us are gonna die. So this makes me even more frightened, I think. Who picked this topic?
You're at 1 minute.
Yes.
Wow. That was bomb.com. Okay, can you show us next?
Oh.
Introduce them. Okay. Yes.
All right, good afternoon, everyone. I would like to introduce our first speaker, evaluator, which will be Karthik, for our speaker, Alfredo. And he's not lollygagging together.
Alfredo. It's awesome listening to Simply Alfredo. I love the title. I thought you introduced yourself well. I love that you talked about your weaknesses, because I think that is the point in the speech where it became very relatable. The first part was a little bit of an intro, and at that point it really grabbed me, and possibly others as well. I'm just talking from my perspective. It helped us, I thought we got some wisdom out of your speech as well, as you were talking about your experiences, which I thought was very cool for an icebreaker. Because technically all you need to do for an icebreaker is introduce yourself using the skills that you have right now, and you gave us a bonus, which I appreciated. Things that you could do to improve, I thought vocal projection would be maybe the first thing that you could work on, so that when you're in a room like this, and we don't have a microphone, well, we do, but we're not using it, to be able to stand up straighter, project further, and you've got a voice that will carry, so that's something you can consider. And also, just breathing, just so that you feel comfortable. I thought you actually got better as your speech went on, which is pretty common for icebreakers. I think when people start, they're a little nervous at first, but once you started, actually, ironically, once you started talking about fears, you got more comfortable. So that was pretty cool. Other than that, very solid foundation. I'm looking forward to your next speech.
Okay, I'd like to introduce our second speech evaluator, and she will be evaluating our Madam President, Samantha. It is Erin Ellis.
Woohoo!
Okay.
Give it to me straight.
I think you did a really good job for your second speech. It was amazing. I probably could have done the same, so kudos on that. I liked that if I knew nothing about naturopathic medicine, I would totally believe you, because your passion behind what you said was super believable. So for that, I would be like, oh, I know what it is now. If you were to do something different, maybe explain. Like you mentioned that there was a lot of different modalities, so maybe go into the modalities a little bit more in depth, and rather than give the example, because that may not pertain to everyone. And I'm not sure if some of the things that you explained, like a regular person would know, like what eczema is. I don't know if you said that, I may have missed that, but if you did, just maybe like bigger words that we know, but the person that doesn't know about naturopathic medicine would not know. So maybe put in, you know, what phys med is or acupuncture and explain how those can help like a variety of symptoms. But other than that, I think you did amazing, and I can't wait to hear your third speech.
Thank you. All right, now I would like to call our Toastmaster back up.
General evaluation. Oh, yeah? Yeah. Just got screwed
No,
up.
it's all good too. Yeah, Toastmaster. Toastmaster introduced them. Reintroduce.
For general evaluator, don't you now just evaluate the meeting before I come back up?
Maren is actually our general evaluator.
Oh, okay then.